Thank you for allowing us into your home today. I'm Greg Gagne, your host. And today with me, we have Ms. Rhode Patriot.
Yes.
She is the owner of Neurowave Diagnostics
Yes.
here in the Lafayette area. And come to find out, she's about the only one in this area, okay, that does EEG.
EEGs for all ages.
All ages. Okay. Well, anyway, you get the message.
Yes.
I think it's something a lot of people in this area need to know. Rather than traveling 2 and 3 hours to someplace else, you can come right here in the Lafayette area and see Miss Rhode, and she will help you with your health issues. And we just go from there. Thank you for coming on board, Miss.
Thank you.
Miss
Thank
Rhode.
you,
I'm
Mr.
sorry.
Greg.
Yeah. Okay, now tell me just exactly what do you do and how did this come about?
Okay. Neurowave Diagnostics was founded in 2022 to help relieve the shortage of EEG tech, and Medicaid patients have to travel far, wait 6 months to get an EEG done. So when I see the need, I did my research and then I opened the company.
So now you found the need to fulfill,
Yes,
right?
yes.
Now, since you've done this, give me a little bit of history about you.
Well, I've been in the healthcare field for over 23 years.
Okay.
I've been working at Ashner Lafayette General for 14 of those. And then I worked in Boca Raton Medical Hospital when I used to live in Florida.
Okay.
And then I have a associate degree in neurodiagnostics, a bachelor in health and science, and a master's in HR.
And a master in HR.
Yes.
Okay. Well, I'll tell you what does, I'm reaching out to veterans, okay? And I'm sure you will help veterans as well.
Yes.
What process do they need to go in order to get to you?
The only thing is they have to have a doctor order or referral to get the EEG done. And we accept TRICARE, and we get a state certification to get contract with the government.
Okay.
And then so that way, whenever the doctor feeling needs for the EEG, they send us the referral, and we can do it same day or the next day, whenever they're ready.
Okay. As far as with the VA, I know the VA gives a certification letter to you guys authorizing you to be able to service veterans. And I'm sure you're going through the process of doing that.
Yes.
Okay. And hopefully that they will, at least the VA will refer veterans to you.
Yes.
But there are other doctors in the area that refers you patients as well.
Yes.
And I'm sure if you let them know that you also help veterans as well in this area, I'm sure they will be helping you as much as they possibly can.
Yes, I would love that because I heard a lot of stories. I mean, I have one of those veterans, his wife is in my program, the EEG boot camp I have. He told me, like, to get an EEG, he had to go to Texas.
Texas?
Yes.
I'm assuming Houston. I'm assuming.
Yes, and he waited 3 months to get the referral there. I'm like, oh my gosh, for an EEG, I'm like, I could have done it here the same day. But he said that's a bigger process. I think there's no hospital around here except TRICARE, so they have to go wherever they send them at.
Well, how many of you are in Louisiana that you know of?
Well, I know the hospitals, but I don't know any outpatients, like clinic that do outpatient EEGs for all ages.
Okay.
Like they have some that do like walk-in patient, adult. They don't do babies. We do infants, babies, kids. And even the kids have mental health issues like neurological disorders. We do them too, as autism, OCD, ADHD. We do all those.
Okay. When you get involved with a veteran that has PTSD, how do you service them?
I mean, anything you have to make the person feel comfortable, and they have to feel like you're confident with yourself, you know what you're doing, and then you walk them through the process, step by step, and you get it done.
Yes. And what about the child, maybe that's
the
having
child is
issues?
The same thing. Like before the test, we call the parents. We tell them this is EEG. It's taking minimum like 1 hour, and the person have to stay still for EEG. And with kids, sometimes they don't keep still.
Right.
So I always tell the parents, I'm gonna need your help. Bring anything that will make your kids feel comfortable. If they need to read books, bring books, iPad, whatever it is. And then that way when they come in, they feel comfortable. And then the parents is right there in the room talking to them, and I'll talk to them. I'll show them on their hand what I'm going to do. And then talk, make jokes, and until we get it done.
Okay.
Yeah.
So in getting the EEG, take me through the steps process.
Okay.
Talking with a client,
Okay.
what process do you go through to sit down with them
Okay.
and talk to them and show them, or rather inform them of the process, the steps that you take in order to do the EKG?
Usually, I call the patient the day before. I told
Okay.
them they have to be sleep deprived.
Sleep deprived?
Yes, because when your brain is tired, that's when most abnormalities show up. Because
Okay.
sometimes you do a wake EEG, it's normal.
It's normal.
And then when you come back, you do the sleep deprived one, that's when all abnormalities show up. So the best, I could say, quality EEG is the sleep deprived EEG, where you have the awake, the drowsy part of the brain, and the sleeping part of the brain, then the awake part of the brain after you fall asleep. So that's a perfect EEG right here. So I'll tell the patient they have to wash their hair, cut their sleep in half. If it's a kid, cut the sleep in half. If you're an adult, only 4 hours that night, or if you can stay up the whole night, the better. And then when they come in, I'll tell them, okay, I need a little bit of medical history to know what's going on with them. And then I'll show them, the test where I'm going to mark. We have to do the 10-20 system, measure the head, and then you score up those placements. I'll show them everything.
Okay.
And so it's not painful. Some of them always think, is there a needle going to my scalp? I'm like, no needle, just some stickers.
Yes.
I'm like, the only thing you have to keep still. So, and then after that, I hook them on, and I'm like, okay, now I'm going to start seeing the brain activity of your brain.
Well, is this something similar to the sleep test? Sleep
Yeah,
apnea?
similar. Yeah.
Okay.
I know the sleep test, they don't really measure the head like this, but with EEG, you have to. Because if you don't have an accurate brain waves. And sometimes you might show suppression. They call it asymmetric. You might have a suppression on the left side, on the right side, and the doctor might say is that a tumor or is that something else going on? So they're going to order a CAT scan, MRI, unnecessarily because you didn't measure the head. So if you measure the head, you put it in the right place, you give an accurate reading.
Okay, so I can see where that's a little bit more informative because I know when I did my sleep apnea test, in a 4-hour period, they said I woke up 123 times.
Yes.
I couldn't understand that.
Yes.
But anyway, I'm on the sleep apnea. I'm on the sleep apnea.
Yes, because the EEG, it will show when you're drowsy. It will show when you're really sleeping. It will show when you're awake. People sometimes pretend they're sleeping. They think we don't know. We know you're not sleeping. We can see the alpha waves,
Yeah.
And then there's a wave that show up when you're awake. We can see that. So we have people dealing with psychogenic seizure,
Okay.
which is like a mental that mimic epilepsy, but that's not epileptic.
Really?
So usually, it's the people dealing with depression, and then bad depression, go to panic attack, and then all of a sudden they start shaking, breathing fast, and people think they're seizing, and they are not. When you plug them in the EEG machine, they have a beautiful EEG with movement artifacts.
Okay.
So that way the doctor refer them to psychiatric health where they need to get therapy to help them come out of it. And it's usually due to trauma,
Okay.
different type of trauma.
I'm assuming for what you're talking about, what about a person that has is bipolar?
Oh yeah, those are neurological disorders as well. So,
So
yes.
how do you work with them?
Same thing. You have to make them feel comfortable. If they get in and see you, just talk to them, make them feel calm. I always tell them, listen to music because music is a healing for your brain.
Okay.
And I'll put some music and I'll talk, make conversation, what kind of food you like, just to get their mind off. And then by
Okay.
that time, I'm done with my 30 minutes, get it done, and and move on to the next patient.
The reason why I'm asking that is because one of my family members is bipolar,
Yes.
and we see him when he's high and when he's low and when he's normal.
Yeah.
So would someone normally come to you to get some information about their activity as far as
Well, sometimes we do events, but as far when I'm doing the EEG, we're not allowed as a tech to give the result.
Okay.
But if I see something, I'll text the doctor, hey, because they can remotely log in and see what we're doing.
Okay.
So I'll say, you mind logging in? Or I'll say, okay, I'm doing that test. I see this. Do you want, sometimes the test, they can order it for 1 hour. It turns out to be 24 hours. It might be 36 hours.
Okay.
So if there's something really abnormal going on, we let the doctor know, and then they take it from there. They'll call the patient or come by, talk to the patient. As a tech, we're not allowed.
So really, I mean, most people come to someone like you, and I know it has happened to me, where I usually ask the question, "How does it look?"
Yes.
and I get the response.
Sometimes I give them a
I can't help
little.
you.
I know. I give them a hint. I'm like, the test. Your doctor or the routine EEG. If you see I'm done within that 45 minutes, you didn't see me take that phone and call. That means you're in the borderline. Okay. So.
Well, what other cases that you run across that was kind of significant that made an impact in your life as far as dealing with a
Well,
certain individual that you
I
really kind of
have
helped out?
I have some kids, pediatric EEGs that I do with cerebral palsy. They really can move. They handicap on the bed, and they having so much neurological disorders, so much like spikes in the brain. Basically, they can catch a break. So kids like that, depending on the medication, depending on the parents who take care of them, they cannot have a normal life. So this really
That's true.
impacted me.
Yes,
Yes.
yes. The normal life is kind of a far stretch for them, I guess you
Yeah, you
can say.
cannot. I mean, everything. They can't even breathe on their own because your brain is the organ that come in your whole body. If something going on in there, your whole body gonna suffer.
Yeah.
Because
I just think that when someone come to you, I'm assuming they're in somewhat of a stressful situation to start off with.
yes.
And if the doctor refers them to you, now, once you perform the services, how do you submit your invoice to VA or submit it to Medicare?
Well, we have
or
a billing company that handle all this billing.
you have a billing company?
Yeah, once they not for me, but we dealing with we hire a billing company that handle all like billing with Medicaid or different type of insurance. They handle that. They log into the system. They get the card information, and they do that.
Okay. In dealing with veterans, do you find that veterans are a little bit more open to sit down with you and talk to you about how they are doing in their life?
I don't think so because I feel like they disappointed somehow.
disappointed?
Yeah, the disappointment is obvious because they feel like they risk their life, put their life in danger, neglect the family to protect us.
Yeah.
And then when they come home, we don't give them the same energy. So they have to wait a long time to get things done. And sometimes lingering around something that could have been done in 2 weeks or maybe the next day, they do it in 8 months or maybe a year later. So I feel like they're not really open to a conversation because they feel like it's pointless.
So
It's
what
like
you're saying
you can't
that-
help them.
So what you're saying is that America will honor veterans when they're in their uniform, and they will say thank you for your service. We will wave the American flag, and we'll post tributes on social media. But for some reason, whenever we get home,
It's
and
not
a
the same.
veteran needs America.
They need the help, and you can see that. That's why you have the high suicidal rate of.
Really?
Yes. If you do a little bit of research, you'll see there's a high suicidal rate of Army soldiers. When they come back home, they can't find a job, or they're dealing with PTSD. They're dealing with traumatic brain injury. They're not themselves no more. So it's a new reality for them, and I feel like some community not equipped to help these people.
I know that there are various organizations here in Acadiana and Louisiana, but I find it very interesting that it's very hard to find these organizations because we don't know that much about them or even that they even exist.
Yes.
And even sitting down talking with you, you've been open since
2021.
2021, and I've never heard of you before.
Yes.
And I'm a veteran, so I mean,
Yes.
but I hope that they would open up their hearts to you to say thank you for what you're doing, trying to help them out. But it also applies to the community as well, because you deal with everybody from children up to senior citizens like me.
Yes.
And we're all falling apart.
Yes, we got people like summertime right now for Neurodiagnostics. It's a busy season. We have people falling, syncope, confusion, heat stroke, so many things. A lot of strokes out there. Epilepsy is high to the roof. So yeah, it's a busy season for Neurodiagnostic Tech.
So really, a EEG helps you to help them
Yes.
understand what they're going through.
Yes, because it shows you the brain waves, the brain activity. If there's something going on, the doctor can help titrate the medicine or refer them to a different type of therapy that they need. Now there's so many other neurological things going on out there. There's VMR therapy where they put you under the light, they're doing EEG, and they trigger that trauma that you've been going through
Really?
to try to help you. Yes.
They trigger it for you?
Yes.
Oh, my
They
goodness.
create a similar, I would say that similar circumstance, like the one that happened to you. And then they have a doctor there nurse is there in the same room, they trigger it to see how your brain react to it to try to help you.
Okay, because I do know that a little bit off course here. When I went to my doctor for my heart, they said, Greg, we want to put you on a stress test. Okay.
Yes.
Well, after about 5 minutes, my reading was like 165. And say, Greg, get off the scale. Get off, stop it, because it seems as if you're not going to go any higher than that. And I said, well, is that good or bad? He said, well, you're doing pretty good considering your age. So if someone wanted to, say like myself, wanted to just come get an EEG from you, do I need a referral from a doctor?
Yes, you will need a referral from a doctor, but the only way we can do it if we do it as a volunteer.
As a
I
volunteer?
I can do it, but the doctor not gonna read it to give you the diagnostic. I
Okay.
can tell you as a research, okay, I didn't see any spikes, but for it to count.
To determine just
Yes,
what's...
you need a neurologist to read it to give you the diagnostic. I mean, when I do event, I do, like when I did the epilepsy event, I try to do as many EEGs to show people what EEG is all about as a teaching.
Okay.
But to get the diagnostic, you need a doctor, you need a neurologist to read that EEG and then tell you what's going on.
Well, put it like this. I'm sure, since you're in that field, that if you see a patient and see what's happening to him, you can determine to say you need to talk to the doctor pretty quick. Say,
yes, I would say that, yes.
You can do that. You can express your opinion
Yes.
or your results to the doctor to say, look, you need to get this person, help him as soon as possible. 'cause
Yeah, sometimes at my job, at my other job where I work, if I see something going on, I text the doctor. I'm like, hey, you might want to come see that patient, or the nurse practitioner. Many times I'm doing a patient, a EEG, and then the patient went to seizures. I mean, non-stop seizure, going to status epilepticus, which is like continuous seizure. And if you don't stop it, you're going to have brain damage. So it's like I hurry up, text the doctor, nurse practitioner. You see, they run down to the EEG department, push medicine, and push the patient to ICU, trying to stop it. So to do this, you have to know what you're doing.
Okay.
When something abnormal show up, you can recognize the abnormality and then get the appropriate help for that patient.
Well, just a little bit of testimony. When I was younger with my children, my youngest boy, we were sitting in the doctor's office, and the doctor was examining him, and my son just passed out. And the doctor was saying, what's going on? What's going on? It seemed as if he had an epileptic seizure, and we have never seen that before in him. But that made us aware of constantly look for signals or signs that he might be having trouble and going into an epileptic fit. So my wife and I, we were stressed out because in trying to take care of him, looking at him all the time, I guess you can say.
Yes.
But in your case, you see them after we see us. But it's nice to know that your patient would know that if you see something that is really something that is harmful, that you would definitely contact the doctor. Say, look, see this person. If the patient understands that, then their trust in you increases.
Yes.
And of course, the word's going to get out to come see Miss Rhodes.
Yes.
And not only make her happy, but I mean, hopefully make the community overall in a better.
And I try to educate people because I know I'm not a doctor, I'm a tech, but I'll give them free books that talk about epilepsy. Like if I see somebody that really need it, I have no clue, I'll buy a book on Amazon, and then I'll say, look, he's talking about all different types of seizures, different type of medicine, what those symptoms look like. So if you read that book, you'll have a better idea what's going on with you. When you go to the doctor, you can be a better self-advocate. If they're giving you that medicine and you feel like it's not helping, you can say, oh, doc, can you try this one instead? I read in that book, that might help a little bit. So you'll be a better self, a better advocate for yourself.
Well, that's a good word. Need to be a self-advocate.
Yes.
You just can't sit back and I'm not saying don't listen to the doctor.
But you still have to do your part.
Yeah, but if you're not happy or you feel something's truly wrong, then you need to express your
concern,
opinion, to the doctor. Because about 2 years ago, my wife went to our dentist to have a tooth pulled, and her blood pressure was like a 225 over 110. And he said, I'm not touching you with a 10-foot pole. Go straight to the hospital.
Yes, can have a stroke.
Well, we went there, and they said, we can't find nothing wrong. They took 7 different blood tests, and say, we can't find nothing wrong. Well, I'm sorry to say, but it wasn't because of what they did. But come to find out, towards the end, she had a leak in her aortic valve right close to the heart.
Wow.
And we wasn't even aware of it. And more or less, she kind of went to a stroke and passed away.
Oh, wow.
But
So
the thing
sorry.
is, though, I'm just saying, as much information as you have, you still don't know all the answers.
No.
You know, because as far as I'm concerned, as far as a doctor's concerned, a doctor is giving you his best educated guess.
Yes, but you have to be able to explain what's going on with you so they can help you.
Yes.
Because if you walk in, you say, "What's wrong?" "Oh, I don't know. I just don't feel good." You don't give them enough information to help you, so they're gonna go by all the common symptoms, try to help. But if you can pinpoint what's going on, they can help you. For example, I have my daughter. I feel like she was having asthma. When I told the doctor that, he said, "You don't have any asthma in your family." I'm like, something is wrong. It's definitely not normal. So what I did a video when she had one of those episodes.
Okay.
And then next time I went to see the doctor, he watched the video. He said, "Yes, your daughter have one of the bad cases of asthma because her heart rate was like 169
Oh, for
for
a
a
child.
kid
Yeah,
like 5 years old. That's high."
Yeah.
So. And then the breathing, like the extended of the stomach, that's all the stuff I read in the book.
Yeah.
But I told him that at the beginning, he was like, brush it off. But when I showed him the video, he put her on medicine right away. He said, "Well,
Yeah.
thank you for taking that video."
So really what you're saying is that the patient's best advocate is themselves.
Yes. Yes.
To really open up to the doctor
Yes.
and don't hold nothing back. 'Cause a lot of
Yes.
times I find that, especially senior citizens, they don't want to give all the information out.
Yeah.
We've been programmed to be
To have
careful.
secret, yeah.
To say don't say say what's actually functioning in your body, and they get a little bit paranoid. Sorry, I'm paranoid sometimes myself. So I mean,
Yeah.
I'm no different than any other senior citizen. But guess what? We're all going to be there one day.
Yes.
Except I'm already here. But I do know one thing though is, I hate to say this, but we're about ready to end this interview. But Ms. Rhodes, I really appreciate you for coming on Veterans Corner interview, and hopefully we can do this in the future.
Yeah, thank you.
Thank you, and hope you a lot of success, and I will surely promote you.
Thank you
as
so
much as I
much.
can.
The only thing I'll say out there, I'm open for any collaboration. If any doctor dealing with veteran that accept TRICARE, you're looking for a place to do your patient EEGs, come on and see us. We are ready.
Okay, well that's fine.
Yes.
Well, all I can say, my people, is this: take care, stay safe, and God bless the United States.